all right? Yes. Good afternoon, everyone. Welcome on to Health and Social Care Committee. Is there any apologies or declarations of interest?
We have an apology from Councillor Robertson. Now, Councillor Crowther was indicated to be our substitute, but I don't see him in the meeting. So we've got apologies from Councillor Robertson. Do we have any declarations of interest?
I'll have to.
Yeah. Sorry.
Do you want to go jump a cloud?
Yeah, just it's under the item 10, the governance report as usual. Just to declare that I'm a non-executive director of partly branching out. Thanks.
I'll declare an interest in item 7, as I have a family member who works within the homeless service.
Councillor McElhaney. Councillor McElhaney is indicating he's got a declaration.
Councillor McElhaney, you declare an interest?
Yeah, thanks, convener. Yeah, I'll declare a declaration of interest of item 10. My wife's an employee of Alzheimer's Scotland, one of the commissioned services.
Right. Convener will now move to a roll call. Can the following members please indicate if they are present at the meeting either in person or remotely? Councillor Brooks.
In person.
Councillor Crowther. I don't think he's here. Councillor Jackson.
Connected remotely.
Councillor MacLeod.
Remotely.
Councillor McCabe.
Remotely.
Councillor J. McElhaney.
Remotely.
Councillor Mackenzie.
Remotely.
Councillor Moran.
In the chamber.
Councillor Quinn.
Remotely.
Councillor Rebecca.
Remotely.
Thank you.
Good afternoon, and if you have any questions...
Councillor Dorian here. I'm remotely as well.
Sorry, Councillor Dorian. I thought I'd missed somebody at the start. Thank you.
How could you forget that face, Jerry?
No, Roberts, Daddy the Buffs.
Just to reiterate, if you want to ask a question, will you please use the chat function if you're remotely, and of course, Councillor Brooks, you can draw my attention. So, move on to item number 2, which is the capital revenue budget, presented on 31st of August 2021. And Samantha.
For yourself, convener, the purpose of this report is to advise the committee on the projected revenue outturn for 2021-22 as at the 31st of August, the current reserves position and the current capital position. From section 5 of the report, you'll see that as at period 5, we're projecting an overspend of 522,000, which is a reduction in costs of 22,000 since the position reported at period 3. It should be noted that in order to get to this projected outturn, Inverclyde Health and Social Care Partnership needs to utilise £810,000 of its smoothing reserves. Within the report, the main reasons for this movement of 22,000 are a projected reduction in costs of 197,000 in external home care that reflects the reduction in hours now expected to be delivered, a projected underspend of £106,000 in residential and nursing following the allocation of pressure monies, a reduction of 102,000 in the turnover savings anticipated, an increase of 44,000 in the projected overspend in children and families' external residential placements due to an additional child needing to be in a residential placement, an increase of 95,000 in the projected overspend in fostering, adoption and kinship that reflects an additional adoption and 2 additional external fostering placements, Finally, a projected overspend of 51,000 against CM2000, the home care monitoring and scheduling system, due to external costs, including increased data access costs. So moving on to the reserves and capital positions. The balance on the IJB reserves as at the 31st of March 2021 was 14.932 million. The reserves reported in this report are those delegated to the council for spend in 21-22, and the opening balance on these is 2.393 million, with an additional 0.73 million received in year so far, giving a total of 3.123 million as at the 31st of August. And finally, the social work capital revised estimate for 21-22 is 1.728 million, and there's been expenditure to date of 80,000 on capital projects. I'm happy to take any questions.
Thanks, Martha. Before we take any questions, can I just reiterate Councillor Crowther has now joined the meeting. And also, I've been advised that item 11 will now be taken after item 6, because after item 7 to 10 we get into private session. So we'll take 11 as item 7, if that's all right with everyone. Okay. And just to keep the confusion going, Sharon sends a message out. I'm interested in Alan Stevenson, but not accused with Alan Stevenson. So thank you very much, Sharon. I'm sure if you understand what I'm trying to say. So Councillor McCabe is the first one with a question. Councillor McCabe.
Yeah, just a couple of questions, Convener. First one is in relation to Appendix 4, the capital budget, and I see the actual expenditure to date in Cross Hill is only £74,000. We projected spend of 720, and we're expecting that the work to be essentially complete by November. So I'm presuming the 74,000 is just a timing issue that we were maybe waiting on a payment certificate at that point in time, because it does seem a bit low. And the second question relates to the environment that we're being asked to approve in Appendix 6, and just if we get a wee bit more detail behind the reasons for the environment, and in particular in relation to the £250,000 SIMD deprivation funding, what are we sort of proposing to spend that on?
Thank you. I think, Samantha, can you answer the first part of the question, and then I'll maybe answer the second part?
Sorry, I don't have the detail with me in terms of the capital.
If you don't have it, you know, make you.
Yeah, we can find out. Yeah, I can find out. I mean, the latest information we have that is from Eddie, and that's what we're reporting on a projection. So I would expect us to spend it, and it's probably just back end loaded, which I don't think is uncommon in capital schemes.
Okay, that's fine, Convener.
Okay, right. Alan, second part of the question.
So the Convener, I think it's maybe Samantha again.
Samantha, I think
okay.
You're here again.
So this is environment that happened last year. So it's money that's just taken out of HSCP and put into a corporate pot overall. So I think overall this is about £1 million now but I don't have the details in terms of what the spend is, because it's not something that I'm involved with. But I know it's money. It's managed as a corporate pot rather than individually within directorates. The 250,000.
Perhaps you could. You happy with that, Councillor?
Yeah, I mean, maybe somebody could send me a bit of the details on.
Yeah, we can.
Yeah,
we can
I
get
would
that.
suggest that. You may forward on
We
to
can get that.
Just in terms of the second environment, is that in relation to, I think, the recent change that was?
Sorry, it was a transfer. Yes, that's a transfer of a couple of some posts from AWS to CLD and the associated costs.
Okay, thanks. That's helpful.
Thanks, Russell. Is anyone else got any questions on the capital and budget report? No, agree to that report then. Great. Item 3 is the Doug Glitchy Death 2020, and it's an ADP update, and Anne Malaki is going to speak to Anne.
Thank you. The purpose of this report is to present the Health and Social Care Committee the details from the recently published Drug-Related Death in Scotland in 2020 report published by National Records of Scotland, and an update of the work of the Inverclyde ADRS will also be included. You remember that Dr. Tony Martin presented the 2019 drug-related deaths data at an all members briefing on the 19th of August. This presentation from Tony Martin was delayed due to COVID, and due to this delay he was also able to cover some of the data that's in this report, so some of it might be familiar to you. While presenting this report, it's important to emphasise that while the report has a particular focus on presenting data, it's important to recognise that behind every piece of data presented, there are people who've sadly lost their life, who've left family behind and friends, and are a part of our local communities. I will recap on some of the data, but I would also like to focus on addressing how we're addressing the issues. So I'll start with some of the data. In 2020, there were 1,339 drug-related deaths registered in Scotland. That was 5% more than in 2019, and the largest number since records began in 1996. NHS Greater Glasgow and Clyde, there were 444 drug-related deaths, an increase of 9.9% on 2019. In Inverclyde, for 2020, there were 33 drug-related deaths, which was no change from 2019. In 2020, there were 28 males and 5 females. NHS GGC has the highest age standardised drug-related death of all the health board areas in Scotland at 30.8, and we all know the statistic.
Seem to have lost Anne temporarily.
Just wait a second.
Yeah, I can do the protocols 5 minutes. Just bear with us, we're trying to get Anne re-established.
If we can help.
She's coming back.
She'll come back. She is. Yes, she is.
Anne, are you back with us?
I think so. I
All
can still hear and see you guys. You're all here, so I don't know what happened there.
We'll continue there.
All right, okay. I don't know where I dropped off.
Just go to the last paragraph and we'll accept it.
Okay. NHS Greater Glasgow and Clyde has the highest standardised drug rate of all the health board areas in Scotland, and we know the statistic that Inverclyde is the third highest local authority level in Scotland. The largest rate in relation to age group in Inverclyde was the 35 to 44 age band. Inverclyde has the third highest rate for 15 to 24-year-old age group, and we need to take a further exploration of this data, what will be undertaken. 93% of all the drug-related deaths, there were more than one drug found to be present, and the table in paragraph 2.9 provides an outline of the overall substances implicated. The rate of implication of cocaine within Inverclyde requires further exploration and discussion with Police Scotland colleagues, and early conversations have begun, and currently they have no definite explanation for that, but we will do further exploration. The graph in paragraph 4.11 clearly demonstrates the known link between deprivation and drug-related death. People in the most deprived areas are 18 times more likely to have a drug-related death than those in the least deprived areas. And as a result, a key priority of Inverclyde's anti-poverty strategy is to undertake an employability pilot targeting a cohort of 20 to 30-year-old males who are unemployed with alcohol and drug dependencies. This pilot will initially target Greenock Town Centre, followed by a second phase targeting Port Glasgow. The pilot recognises the challenges to be overcome in relation to reducing poverty and increasing employment opportunities while tackling health inequalities. Paragraph 4.12 to 4.15 of the report outlines the funding streams that have been announced recently by the Scottish Government. And paragraph 4.16 describes the progress over the past 12 months, and I've included some recent developments in what I'm going to talk about shortly. Over the last year, good progress has been made in several key areas, including the inclusion of the third sector to distribute naloxone. And just this week, we have a naloxone coordinator taking up post, which will be a key role in promoting the distribution and use of naloxone within Inverclyde. We have the development of an information sharing protocol with key partners to ensure an assertive outreach within 48 hours to anyone who has a non-fatal overdose. And Turning Point Scotland have been commissioned by the Scottish Government to enhance this service, and they've started working in Inverclyde this month and currently in the process of developing pathways with ADRS and other services. They'll be offering a 7-day-a-week service till 10 p.m. at night, and that work will support those most at risk into treatment and try to keep them established within treatment. Within the ADRS service, we've reduced the waiting time significantly, and the work ongoing to support service users into appropriate doses of treatment and introduction of Buvidal, which may change prescribing practices. The Scottish Government have recently announced funding specifically to increase the use of Buvidal as part of the medication-assisted treatment standards. We're also aiming to conclude the ADRS redesign, and the next following paper will outline that. The review of all the drug deaths are on a multi-agency basis to determine any learning and improvement in practice. There's a test of change with the care navigators to work intensively with the most vulnerable service users known to homelessness, ADRS and criminal justice. Members will be aware of the previous paper on the Recovery Commission, which is progressing through the commitment team, and we aim to have that service in place by April 22. Inverclyde ADP has secured funding from the National Drug Death Task Force to employ peer navigators in Greenock prison custody. As a means of early help, the test of change has the potential to influence practice across Scotland, targeting a group of people who are at currently increased risk of drug-related death, and that service is due to start in February 22. More recently, Inverclyde ADP has been approached by several small community organisations and third sector supports who play a vital role in enabling recovery. They've indicated that they have difficulty in securing suitable venues for their activity. And at the same time, through a recovery development group, there's an increasing number of community organisations and third sector partners participating in the group, and an increased enthusiasm for collaboration. The ADP are working with partners to secure and fund a venue for a recovery hub. Just this week, the ADP have approved and submitted a bid to the Cora Improvement Fund. The proposal has been submitted jointly by Inverclyde ADP and Turning Point Scotland, as Inverclyde ADP recognise that there's an urgency to develop a radical model of recovery where there's a fast and appropriate access to help that includes residential rehab as an option. The aim of this project will be to provide a clear and accessible recovery pathway into residential rehab and ensure that people are supported in preparing for residential rehab placements, whereby increasing the potential success of the placement and ensuring people are prepared and supported following a residential placement into recovery. There's been a huge amount of progress made across the ADP and ADRS services. The pace is fairly fast, and the additional funding from the Scottish Government is very welcome. However, it does present challenges in keeping partners updated on the progress. As part of the AD communication strategy, we're going to produce a regular ADP newsletter to try and assist with keeping people up to date. It's recommended that the Health and Social Care Committee note and give comment on the drug-related deaths in Scotland 2020 report, and approve the work being driven through the Inverclyde ADP partnership in relation to drug death prevention. And I'm happy to take any questions.
Robert. Thanks for that. Councillor Brooks indicated he wants to speak, but I have to say Councillor Betty was in first, so I'm going to give Councillor Betty an opportunity to speak. Then Councillor Doreen and Sharon McAleese, Councillor McCabe, Mark Lenny, and then Councillor Brooks, to be fair. So, Councillor Betty.
Thanks, Convener. And it's actually just methadone, and we see that people are dying of it. And yet, my understanding, when you go into the chemist, you get your little drop and it's over. And 9 times out of 10, it's, if you've overdosed in it, how many, is it straight methadone, or after they get their dose, do they turn around and mix it with something else? That worries me, because we'll give them stuff to try and help them, and yet after the length of time some people are on it, they're still not any better. Should we be looking at something else? Personally, I think we should be looking at rehab in certain cases to see how they get them. But I just wondered how many were dying with methadone.
So the report shows that it's not one drug that's present in people who are dying of drug-related overdoses. So in Inverclyde, there's or all over, there's 93% of people have more than one drug. So methadone may be a factor, but it's not the only factor in the deaths. It's difficult to know when most of it will be prescribed, but it might be being given to other people. So it's really difficult to know the circumstances of where people are sourcing the methadone, but it also includes, it could be heroin that's part of that. We do recognise the need to get people into residential rehab, and that's one of the pieces of work that we're taking forward about with Turning Point Scotland, and ensuring that we have that pathway and that people are supported into residential rehab and supported when they come out, to ensure that the success of that. Buvidal is another option. So there are increased medication options, and Buvidal is one of those options, which is a long-lasting medication, which saves people having to go daily to chemists, and it means that it's not a physical preparation that they would be holding on to, so there would be less chances of overdose. So that's something that we're looking at, increasing the use of Buvidal across our services. And the Scottish Government just last week have announced further funding to support the increased use of Buvidal.
Tell me, is it worthwhile looking at, and I mean seriously, group meetings where you've got them there, another thing, you've got them together, but they also kind of a cup of tea or a soup kitchen, which gets them off and gets them into a different sort of environment, you know, and that, by making sure they've got something to eat, that might help, you know, and it might be just a plate of soup, but it's better than nothing, and it's better what some of them are doing. I just wondered, you know, but thanks for what you said on that. I just, you know, it's awful when it happens and we think we're making them better and we're not helping the situation, and it keeps going, and some of them might get a shock how long some of them were on methadone, and that really upsets. But that time we should have been doing something else. I don't mean just us, everybody I'm talking about. We should have been looking at something else because it wasn't working. Thanks.
Thanks, Councillor Beckett. Councillor Jerry Rory.
I've got 2 questions. The first is, do we have a figure for the number of people that are in residential recovery? And the supplementary question would be, there's been widespread advertising about the distribution of Naloxone. Have we any kind of initial results on that?
Thank you. The first question, so the figure of the number of people in residential rehab, it's not something I have at the top of my head, but it's something I can get that information. The numbers will be fairly small, but it is something that we're looking to increase. We'll get increased funding from the Scottish Government, and with the pathway that they develop, and we do recognise the need to increase the use of residential numbers, so I can get what we currently have.
Okay, thanks.
And the question about naloxone, we can give information about how many kits have been distributed, but I suppose it's really difficult to determine the success or what impact it's having. We can give information about the numbers that have been distributed, the numbers that have been used, which would give some indication that perhaps saved a life. But I suppose it's really difficult because it's a complex issue and there's complex factors to know. But the number that have been used is probably the best indicator that we could give at the moment.
That would be good.
Get that information as well.
The kind of thing that I was wondering about was over the previous health and social care meetings, we were saying that there were trials going on with the police in Glasgow, but I think it's a good scheme now that the distribution is more widespread of naloxone, and hopefully it should improve matters. Thank you.
Thanks. Councillor McCabe.
Yeah, thanks, convener. I mean, I think obviously we've seen these figures before. We had the presentation, but I suppose, and you can become a bit sort of blasé to some extent about them. But the reality is these figures are shocking. There's no doubt about it, and they underline both the national and the local crisis we have around drugs deaths and the need for action. And I think you recall previously, convener, that the committee did ask you to write to the drugs minister to ask for a meeting, and I think I'm pleased to say that she is intending to come down next month for a meeting with yourself, myself, and Councillor Robertson as the leader of the largest minority group. So I think I would welcome that opportunity, obviously, to have these discussions directly with the drugs minister. And obviously the funding the government has announced is welcome, but the reality is £250 million over 5 years, as I've said before, is a drop in the ocean. And the relatively modest amount that we've got here, additional funding we've got in Inverclyde's, a drop in the ocean. I was wanting to follow up Councillor Dorrian's question around residential rehab, and maybe it is something we need a specific paper on. But it'd be interesting to understand the sort of the costs of residential rehab, and I understand every individual is unique, but there are obviously programmes that last for however many weeks, so it'd be useful to understand what it actually costs and how many individuals actually would that extra £82,000 support to put through rehab. And it would be useful to understand who we would intend to use for residential rehab. There's obviously been some discussion previously about local organisations that do residential rehab. It would be useful to understand who would we use and what type of programmes that we would put in place and what the cost would be, because clearly there is now a renewed focus on residential rehab, and I think it would be useful to get a bit more information on the approach that's planned to be taken.
Thank you for that, Councillor McCabe. We could probably look at get some information to Councillor McCabe. In fact, the rest of the committee on regarding that issue of rehabilitation, which seems to be a hot topic at the moment.
Absolutely, and I can take that as an action and come back with some further information, convener.
Okay, Councillor Gerald McElhinney.
Thanks, convener. My question's on the employability pilot. Just asking if it's up and running. If so, what's been the uptake, and have we got any early indications of success?
Anne.
So that pilot is being run by our Welfare Rights Service. It's in early stages and we've not recruited to it yet, but I can provide a timeline, provide further information back about when they're expecting to actually start taking on people with that service, but it's in early stages of the planning.
Jim? Okay, Jim's after that. Councillor Mackenzie, Drew?
Thank you, convener. Yes, I understand this all about the Inverclyde from the highest rate of drug users in the country. And you mentioned Port Glasgow as part of the strategy going forward. I make these comments with my Port Glasgow hat on because people in Port Glasgow really need help now. The town centre is becoming quite a chaotic place. It seems to be a strategy, perhaps through River Clyde Homes, perhaps through certain agencies, that drug users are getting rehoused within the town centre. And I heard the expression used, vulnerable service users. And that expression would not sit well with the population of Port Glasgow, because I would tend to say there's vulnerable old ladies and vulnerable young mothers and vulnerable shopkeepers on that street and vulnerable people going to church, and they are being accosted on a day-to-day basis. There is violence in the streets of Port Glasgow. There are fires now regularly. There was 2 last week in King Street, and I think they both emanated from drug users' apartments. The strategy is good and well, but we really need more people in the street, in the town centre street, to deal with this chaos, nip it in the bud. We really need to be engaging with these people. They're walking about the town like half-shut knives. They're walking about in a trance. They're tapping folk for money. And we need to be on the streets and dealing with them and engaging them directly. We can talk about it all we like, but until we have action in that respect, nothing's going to happen. Thanks.
Thank you. I can see a very compassionate contribution from you there, but I don't know how much I can do ourselves, but I suppose it's for all the agents to work together to try and resolve that situation we have in Port Glasgow. But Alan Stevenson is going to say a couple of words here.
Convener, thanks through yourself. Thank you, Councillor Mackenzie. Yeah, it is a multi-agency approach. What we're going to do is look at how we use our health and social care resources to meet the needs that these individuals have. Obviously, we won't go into the history of some of the issues that we have, but they are complex. But as you'll hear later, at the committee, we are making tangible efforts now. We're looking at how we are providing services, and we're looking to build relationships with adult individuals to see how we can assist people to start to move on and take control. But I do accept, and it's a multi-agency response, and all the partners around the table have got responsibilities to try and input positively so that we can actually help people to take control and move on and start making some good decisions. And there is, in some sense, we have to build relationships. There are lots of interventions, but on a human level, we have to sit down and build relationships with adults and look at a recovery focus, because there is other choices that people can make. And we know in other parts of Scotland there are very successful recovery communities that are doing well. So we are focused on looking at our recovery communities as well as looking at residential rehab and a kind of range, and also having input from a multi-agency partner perspective will all help us to start to build positive relationships with adults and give them proper choices moving forward. Thanks, Convener.
Thanks, good. Okay, Councillor Mackenzie. Councillor Brooks, very patient right now.
Thanks very much, Convener. I had a question I thought was going to come up on item 4, the service redesign, but Anne has brought it in. So if officers wish to wait to item 4, then so be it. Recovery facilities are obviously crucial as we move forward to a recovery strategy. And Anne suggested that the third sector and multiple agencies are looking for better facilities to allow that to happen. So there's a balance between bringing everybody together. When I say everybody, I'm talking about third sector organisations, and to one facility, which could be maybe cheaper, maybe a better focus for officers, but nevertheless might not be the best for our service users. Inverclyde is obviously a long stretch geographically. So I just wondered whether, are we going down a rabbit hole of trying to bring everything together into the one geographical location, or are we thinking wider that Inverclyde communities, plural, may need a recovery facility so that local people can find the service they require on their doorstep?
And you want to answer? You want to wait? We go to the on the agenda on 4.
No, I'm happy to take it now to respond. So I think there's probably a variety of options that are needed. There are some benefits in having a recovery hub where people know that they can approach and they can come to, and it's in a central, easy to get location, and that we can staff that with a number of people and offer a number of services. And there is an argument for having localised, so we need to try and do a balance, but there is that critical mass that we need to be able to provide services across a range of areas and a range of people, and that hub approach has benefits for the third sector organisations because we can provide some sort of accommodation that they can use safely and help them staff that and provide services from there. And I think so we will start off with a recovery hub, and we would look to increase that recovery approach across local communities, and we would hope that as people join that recovery network and hub, we get more ideas and thoughts from the people who are likely to use it and what would really benefit them, and we can grow it over time.
Yeah, thanks for that, Chandler. Yeah, I just hope that the voluntary organisations are at the centre of these decisions to ensure we serve our communities, plural, the best that we can. Thank you.
Councillor Quinn. Quinn.
Yeah, thanks. It's probably linked to Graham's question there about the third sector. I was actually waiting for him to come in because I knew that we'd mentioned the third sector. So Graham and I were, and a few others were actually at the Your Voice AGM this morning, and we had a brilliant presentation. And one of them that did sit really nicely was one of their presentations on recovery. And the fact that they have workers there with lived experience, which I think, and they had said, is really, really important. So it's really just a quick question around that, probably linked to Graham's question, and how we, give them their place, because they are doing, a fantastic job. And it's maybe linked, to Graham's questions as well about the location and making sure that the service or what they provide is led by actually the service users and not by what's more comfortable for us. So probably linking to what Drew said, having something maybe in Port Glasgow town centre would be a great idea, because it's really targeted and focused and really near where it needs to be. But just a really quick question on obviously all those third sector are doing a fantastic job, and there is a number. I'm just pointing out Your Voice because we were at the AGM this morning. But how are we ensuring that we are supporting the peer supporters? They are doing a great job, but we have to make sure as a council that we are giving them the support that they need. Thanks.
Anne.
Thank you. So there is a recovery development group that Anne Wardlaw, as the ADP coordinator, chairs and supports. She supports that group with Your Voice and CBS. So there is a network of third sector organisations, and CBS offers support to all the organisations, as does Anne Wardlaw, and that recovery group is the place that we are developing the recovery programme and the peer support network.
Okay, Lynn.
Okay, thank you.
Councillor MacLeod, Jim, you get anything to ask?
Yes, thanks, convener. I mean, the figures, there's no getting away from it. The figures locally and nationally are grim. It's terrible that we're in this position. But we are taking, there's initiatives which are mentioned within the paper. There's 6 initiatives which the Health and Social Care Partnership and other agencies are working together to try and tackle the problem and the issue. We can never get away that this is certainly in 2019 and 2020, each year is 33 people sadly lost their lives to drugs, and the impact that's got on their family and their friends, and we should never forget that. But it is good that these initiatives are being introduced to tackle the issues. It's good that obviously there is additional money coming from the Scottish Government, and I think it's good that we're seeing Naloxone beginning to be rolled out more now, certainly in our third sector, and with the police, albeit it did annoy me, certainly, that the police, the pilot, was originally with Glasgow, Dundee and Falkirk. And I have no qualms at all about Glasgow and Dundee, which have got horrific numbers as well. But I thought that Inverclyde should have been certainly in amongst the pilots as well when that was announced. Regarding, I've got a couple of questions to ask. Is the 33 people who sadly lost their lives? Can I ask if we know how many 33 people were known to Health and Social Care Partnership? How many were, being treated within the ADP, and also, do we know any number of people who sadly lost their lives as well, who perhaps had recently been released from prison and maybe hadn't been taking substances or certain substances for a long time before that? So if you could, that'd be good if you could let me know.
And do you have the figures at hand, or you need to look into it?
Have some of that information. So we know from the 2019 that roughly 30% of the people who died of a drug-related death in 2019 were known to services. So that leaves quite a large number who were not known to services. We haven't done the analysis on the 2020 yet, because Tony Martin will provide a more detailed analysis on that information, which we will report on. But I think routinely or regularly it's around 30% unknown. We also know that in terms of so the about 30% of people in police custody, there's about 30% of the drug-related deaths have been in police custody or prison custody in the 6 months before their death. So that's part of the reason that we're going down that early help route and offering support and to support people coming out of prison. So we recognise that is a vulnerable group where there's high risk, and the early police custody help pilot is to support that group.
Jim?
Yeah, thanks for that information. I think certainly there's obviously a job still to be done to reach out to more people, or to try and encourage more people that haven't taken up opportunities of treatment to being able to start taking treatment to try and help. And obviously I welcome, of course, the opportunity for more rehab, because I think ultimately that is something that's definitely going to help. Okay, thanks.
Thanks for that, Jim. Remember that report was just for notice, so we're quite happy to note that report. Item 4, again, it's Inverclyde EDRS, is inclusion of the service redesign. Anne.
Thank you. The purpose of this report is to provide the Health and Social Care Committee with a final overview of the work progressed within Inverclyde EDRS service and to conclude the redesign. People will know that the Inverclyde Alcohol Drug Recovery Service has undergone a service review over the past 2 to 3 years. The final phase of the implementation plan was put on hold at the start of COVID. However, it recommenced again in September 2020, with 4 subgroups taking the work forward, and they were reporting to a steering group. The steering group oversaw the implementation plan and took forward the range of subgroups to develop the new service model. Those work groups were being a workforce subgroup, a care and treatment, performance information, and prevention and education. This report is seeking approval to conclude the ADRS steering group and the associated work stream. Ongoing service development will continue at an operational level with regular reporting on activity through the ADP. The Health and Social Care Committee is asked to note the level of activity undertaken as part of the service redesign, and that's detailed in the attached report as Appendix 1. And asked to agree to conclude the ADRS steering group and the associated subgroups, and agree that future work will be delivered as part of the service operational plan, and that future reports will be scheduled through the Alcohol Drug Partnership. I'm happy to take any questions on that report.
Thank you for that. Councillor MacLeod, I'll let you in first this time. Jim?
Yeah, thanks, convener. it's obviously good to get this report and see what's been done and at what levels work is carrying on and what's been completed. Obviously it's all at different stages. And can I just ask, regarding some of the initiatives, we've seen some that's been completed in 2018, 2019, 2020, and I just wondered if you were able to give us maybe outline for us the impact that some of the initiatives which have now been completed, what sort of impact it's been having in tackling the issues in drugs and alcohol.
Anne, did you tear up, Councillor Cloud?
Yeah, okay, thank you. So some of the redesign, the plans were in place, and then obviously COVID impacted, but in fact COVID actually helped us to progress some of those areas. So previously there was a drug service and an alcohol service. We have now combined those services to the one ADRS service with a single, that gives people a single route into the service, a single screening point of access, which has speeded up the waiting time. So we've rapidly increased the waiting times, reduced the waiting times for people accessing the service and getting into treatment. We've been able to introduce a range of treatments, so increased options around medication, the Buvidal, implementing the Buvidal. So there have been a range of services or benefits from pulling the two teams together, in that there's a more holistic approach. People often have both complex addictions and drug problems, so they're not having to being seen by separate teams. They can be addressed by the one worker within the team, or one part of the service, and don't need to see multiple workers. They work closely with the consultant psychiatrist, so people can be seen for ADRS issues or alcohol and drug issues and psychiatry at the same time. Those are some of the kind of initial benefits. I could probably provide you more detail from the work plan and provide you more follow-up to that, if that would be helpful.
Yeah, I think I would be helpful. Yeah, that would be helpful. Yeah, thank you.
Well, I don't see anyone else have any questions for panel on this item, so we agree the recommendations. Great. Item 5 is Action for Children, Untitled Wellbeing Service, and Sharon. What do you think? Sharon?
Thanks, Convener. This report is primarily to provide members with an update in the development of the Wellbeing Service. Service is now in its second year of operation, and this report provides an overview of progress that has been made, both in terms of establishing the service, its multi-agency linkages, the arrangements that we are trying to put in place in relation to a single point of access for children with vulnerabilities of this type, as well as providing the overview of the data that we have to date about how the service has been delivered, the amount of uptake, a description of the types of work that we are seeing coming through by way of referrals and sources of referrals. The numbers are positive. In fact, in the context of the pandemic, they're really, really encouraging. I feel overall very, very positive about what's been able to be achieved here, and look forward to seeing this service go from strength to strength. We've exceeded in most part the areas, apart from face-to-face contact, and that's the area that obviously was impacted most directly by the pandemic. So happy to take any questions.
Thank you, Charles. I don't see in the chat. Jim McLeod?
Yeah, thanks, Convener. Sorry, did you say myself there?
Councillor Tate just come up before you, but I'll give you the benefit of the first question.
Oh, sorry about that. Sorry about that, Robert. Yeah, the question. I mean, it's positive. I actually thought because obviously what we hear in the news is that things have been very challenging, and I can imagine why they'd be challenging. With there's a lot going on in the last 18 months, and it's affected so many people. children and adults and families. And I actually thought when I first started reading the report that the numbers would be far higher of young people seeking help and getting help. So I'm encouraged that the numbers are actually lower than I first thought. That's not taking away the fact is that the numbers of people there are still, the numbers of youngsters are still very troubled and needing that help and support. But I just thought the numbers would have been far higher than what they are.
Thanks, Sam. Councillor McCabe.
Yeah, thanks, Convener. Obviously welcome this report and that we're getting this information. And I suppose it's clear that the service was sort of launched at a difficult time, and that has reflected in the sort of the ability to have those face-to-face contacts as widely as was hoped for. But I think we're now getting there in terms of the progress. But there are still 77 per this report on the waiting list. And I know later on in the sort of financial section that there is a potential underspend. So it might be that we can increase capacity. So it'd be useful if that could be done. But I suppose the question around that is in terms of staff and being able to attract staff. One of the concerns when this sort of type of service was getting launched nationally was whether there would be enough staff out there to be able to provide the service. So it'd be useful to know what the sort of current sort of staffing situation is. And I see Action for Children advertising locally for staff as well. The other main question I had was around the impact potentially this service is having on the CAM service, in terms of whether we're seeing less people being referred to CAMs and CAMs better able to, I suppose, deal with the caseload that they've got, or in fact are we seeing sort of more referrals onto CAMs and put more pressure? It'd be interesting to see, because looking at the sort of the analysis, obviously anxiety and emotional behavioural difficulties are the sort of main issues that are coming through from young people. So it'd be interesting to hear about that. And well, it doesn't need to be today, but it'd be useful to get a wee bit more information on the group work programme and what's involved in that. Just for certainly for personal information, if not anything else.
Sharon?
Thanks, Councillor McCabe. I can address the two and deal with the third. The first one that you raised in relation to the qualification, and it might be that we're at cross purposes, but I think not. I think the issue when this was initially being launched, the concerns were around the availability of, and if my memory might be failing me here, but it was COSCA registered individuals, because there was a requirement for this to be counsellors who were COSCA registered.
Yeah.
The particular approach that we've developed in Inverclyde is quite unique. We worked with our colleagues at Scottish Government to broaden the scope of what was being provided, and we levered in that additional funding from IJB to enable us to provide a much more holistic service. That was based on a perspective that we had here in Inverclyde, that the purely one-to-one didactic counselling service that was going to be school-based would take us so far, but not far enough. So what we wanted to do was to provide a much more holistic community-based support. What that has enabled Action for, and that's what we've agreed, and that's what we've commissioned for, that's what Action for Children tendered for and were successful in. That's given them the scope to have a bit more latitude in terms of who they recruit, therefore, and they've been able to do things that we were hopeful for but are delighted with. For example, recruiting individuals with lived experience, local people employed in the project, so that we're reflecting a range of skills and abilities, and that is all gelling together and it is working well. And I think what we'll see is strength emerging from that as it goes. As it happens, the feedback we're currently getting from Scottish Government is that they think this is a standout model, and that they would be keen for other people to look at our model as we go forward. That part of the issue touches on your second issue, and it also addresses in part Councillor MacLeod's comments, and that's about the data. We're year one, and we probably won't be able to make any definitive statements about what the data is really telling us until we start to build some trend information. We had our predictive data that was only that. It was predictive because it was a brand new service, a brand new area of service delivery. We've got year one data. We've obviously got the COVID impact, which is going to make it difficult for us to help us to work out just where are we. But when we get year two data, or even if we can start to break that down into quarterly data, that'll help us to begin to understand a wee bit more in detail about trends. But you're specifically in relation to the issue in respect of CAMS, the pressures on the front door of CAMS are increasing. So there is an increase in referrals, and I can provide you the specific data about that. I get a weekly report on the referrals for CAMS, but it is definitely increasing. The increase is sharp. However, I suppose the question we need to ask is this preventing that being even higher? So are we diverting? And that's something that I'm looking at closely in the one-to-ones I have with the manager for CAMS. And our view is that yes, it is. It probably is diverting. But equally, there's a really important part in that paper, which is about that one-door approach, where we've got all agencies screening referrals so that we're saying get the help to that young person as quickly as we can for the right service. And that is something that we haven't had before. So again, that I think is a hopeful direction of travel. In relation to the group work programme, I can contact the Action for Children manager, get details about that and get it sent directly on to you.
Okay, thanks for that, Sharon. That's very helpful.
Thank you, Sharon. Well, I don't see anyone else have any question for Sharon. So again, with the note this report, you agree with that recommendation?
Yes.
Item 6 is the Chief Officer's report.
Thanks, Convener. Through yourself, this is just an update report on some of the activity we're involved in during this COVID winter period coming up, and it's really just for noting we're just being cautious about the number of reports we're bringing forward, but I just wanted to give the committee a sense of some of the other work we're involved in, and the unscheduled care commissioning plans are work in progress. We're working with the other 5 partnerships across Greater Glasgow and Clyde, but just to show you the amount of work that's going on in relation to unscheduled care, so that's unplanned, if you like, work that comes in through the system, and we're working as part of the 6 partnerships across Greater Glasgow and Clyde, and there'll be a final report of that sometime near the end of the year, beginning of next year. But I just wanted to give the committee a flavour of some of the other pieces of work that we're involved in. Thank you.
Councillor Brooks.
Thanks very much, Convener. Yeah, I know on the COVID and seasonal flu update at 5.5, and anecdotally, constituents are very pleased, obviously, at the facilities being made available and the process that's happening. But there is an observation from them, not a complaint. There's an observation that the booster COVID vaccine and the flu vaccine delivery is not as efficient as it was when we were doing jabs 1 and 2. So has something changed? As I said, there's no complaints. We're all very thankful the staff are delivering these vaccinations. But has something changed that means that some seniors are queuing in the rain for half an hour before getting into town halls?
Convener, through yourself, maybe Alan might want to come in and briefly give an update on that, and I can come in as well. Thanks.
You're on mute, Alan.
Yeah, sorry, there could have been technical issues. Sorry about that, Convener. We've actually been feeding, but as you know, the HSAP has been carrying out the vaccination process for our adult care homes and older people care homes, as well as the housebound. It's a national programme which is the majority of the population in the designated centres. Certainly, in terms of the current processes, I think there has been some teething issues that we've been feeding back to the board on in terms of the waiting times. That's been down to demand and also availability of vaccinators, which we get centrally from the board. And certainly we on the whole, the process has run relatively well, but there has been instances, unfortunately, where demand and availability of vaccinators have compounded together to mean that folk have had to wait a bit longer. The other technical issue that has delayed things slightly in terms of the third dose, there is a technical issue that folk have to wait 180 days before they receive their next vaccine. So vaccinators have to double check that point before the third vaccine for COVID is given. And also there's a bit of discussion around when individuals come, are they wishing just to have the COVID vaccine booster, or are they wishing to just have the flu vaccination, and going through the safety aspects about pre-giving a vaccination beforehand. So that's taking a bit longer than was anticipated as well.
Yeah, thanks very much. So officers are aware of it. Officers are aware of it and they're dealing with it, and that's the answer. Thank you very much.
Can maybe just say in a personal view, I took my mum for her booster, the town hall, and it was quite busy. Lincoln was there with a lot of younger people. But what is important, if you bring someone with you, they give my mum a seat and I stood in the queue. So it's a good idea that, if somebody's along with you, they can take a place, stand in the queue, and they give the elder person a wee seat while they're waiting their turn.
And convener, just through yourself, Alan touched on it in terms of the HSCP staff. I'm very pleased to say, in terms of the booster JAG, our team have been out and been round all the older people's care homes and the adult care homes now, and the people who are willing and able to receive that vaccine have received the third dose. So the team were very quick off the mark. We did a lot of planning last month to make sure we had suitable numbers of vaccinators in the HSCP to carry that out. So I'm very pleased to confirm that third round of boosters visits have taken place, and anyone who will then go on to be entitled to receive the JAG will be picked up by their own teams as the weeks and months go on. So I'm very happy to say we have been out and we've completed that piece of work for our most vulnerable service users in Inverclyde.
Thanks. Councillor MacLeod.
Yes, thanks, convener. A couple of things. But first of all, I have to congratulate the service and everybody else who's been involved in the vaccinations over the year so far. First doses, second doses now, booster JAGs, and the flu vaccinations as well. So well done to everyone involved. It's been a mammoth task, logistical, very difficult logistically. So well done to all and sundry. Just regarding the booster JAGs and the flu JAGs, I know that now the Health and Social Care Partnership, I've sent some questions already to Alan about this, but it's just about the delivery of the booster JAGs and flu JAGs are now done by HSCP and the board rather than by GPs. So it's just, again, to seek assurance, that there's no impact on this, because at the end of the day, who knows their housebound patients better than you would hope than their general practitioner. So it's just to seek assurance on that. The other question I had was about the booster and the flu JAGs. Now I know some people who have had both JAGs have had them together, but there are some people who are a bit fearful, are a bit cautious, and they're wanting the JAGs to be given separately. So what I was wondering was what sort of impact by having the JAGs separate, because it means obviously that the individual has to go back twice. So what is given priority? If somebody says I don't want my flu JAG and my booster together, what is usually recommended to people? Do they get a booster first, or do they get flu JAG first? And what is the time gap? If they say I don't want it today, what is usually offered? Is it a week? Is it 2 weeks? Or is it further afield? You know, what happens there? And I just hope that both boosters and the flu guys get rolled out as quickly as they can. Okay, thanks.
Alan Best, could you maybe help here?
Just in terms to give reassurance, our priority is always, in terms of our community, is our most vulnerable. So in terms of our housebound delivery, we'll always ensure that those who are requiring a vaccination and wish to have a vaccination would receive a vaccination. If they're unable to go to the centres, we'll make sure that we get to them. We are also very grateful to yourself and your colleagues where you highlight where somebody has perhaps not been able to, for what various reasons, not been on the housebound list, and we'll immediately address that. So I will give that reassurance. In terms of your second questions around the flu vaccination and the COVID booster vaccination, it's perfectly okay to get both of them together. As we know, at the end of the day, it would come down to personal choice of what the individual would wish. If they're not unhappy or for whatever reason not sure about getting both together, the first thing we would do is obviously give them the full information and reassurance that it's safe to get two together. But if they felt for whatever reason they were unable to do that, it would be personal choice on their part about which one that they would want to receive first. We wouldn't really be in a position we would recommend one or the other. What we would recommend is both would be a good idea about protecting themselves and others within the community. But if somebody was in a position that they only wished one, they would certainly get that one, and they would be able to rebook the other vaccination really as quickly as they can. At the moment, the JVCI has said it's actually fine for both of these vaccinations to be given together. Previously, in other vaccinations, we've maybe left 7 days apart or 14 days apart. But in this case, it's really as soon as the individual wishes to get their second vaccination. But again, we're always keen to speak to folk and make sure they're fully informed about their choices.
Okay, thank you. Councillor McCabe.
Yeah, thanks, Convener. I mean, obviously the delivery of this vaccination programme is an enormous undertaking, and I have seen some criticism that potentially the sort of programme is slipping. So it would be useful to get an understanding locally, are we seeing a slippage in the programme, and are there challenges? And can I have an assurance that I'll get my third dose before I'm forced to come into the chamber to chair the Policy and Resources Committee, so that Councillor Wilson can exercise his democratic right to sit in the chamber?
I know. Councillor Becky, Sharon.
Just to say what Alan Best said, I got mine yesterday, and there was a mixture of older people and young folk there yesterday, and you've got a choice, and they'll give you whatever one you want, whether it's a flu jag if you only want one, or the booster, and at the same time they tell you very plainly whatever one you didn't take, you can go and get an appointment for that and you'll get it. And there's no problem. And you get 10 minutes to sit down, supposed to be after it. Okay, but no, and they were certainly moving people yesterday.
That's good to hear. Councillor Becky, thank you for that contribution. If there's no other questions, the Chief Officer report, we thank you.
Councillor McCabe did ask a further question about whether obviously the process has been delayed, and in replied, I'm not speaking on behalf of Councillor McCabe, he can speak for himself. I didn't hear an answer.
I lost that one.
Convener, through yourself, Alan and I can check about any slippage, but certainly the HSCP programme that we're involved in, we are managing to carry out the plan that we intended. But Alan can go back to colleagues in Greater Glasgow and just confirm if there's any significant slippage in relation to that, to give Councillor McCabe the assurance that he's looking for. Thank you.
Thank you, Councillor Book, for keeping on my toes. Sorry. If there's no other questions, we'll move on. And report now to take item 11 before we get to private session, which will be item 7. And this is the Afghan Migration and Resettlement Scheme. And Sharon, are you on the picture for us? You're on mute, Sharon.
Apologies.
Alright.
I've got this particular report electronically, so I'm not able to see my screen quite well. So this report concerns the Afghan resettlement programme, and the recommendations that are outlined in the report. But by way of background, members I'm sure are very well cited on the issues that has led us to the current situation. The report outlines the background to the various strands of resettlement work that have been taking place within Inverclyde, and the role of the HSCP in supporting that. At committee last year, we had secured agreement to continue with the various strands of those schemes. And in the interim, as we've been working towards that, we've had the acceleration of the Afghan programme in particular. And part of what has happened through the process of that is an amalgamation of the various strands of the various resettlement programmes. This paper focuses on the immediate period going forward up until the end of this financial year, and looking specifically at the Afghan resettlement arrangements. Part of the issues here are some of the complexity here, and my colleague Craig is here, who has done a sterling job in supporting us with the financial framework around this, is that it has been a moving picture and it's been moving very rapidly, and I'm sure that members understand that. You'll have seen that played out in terms of the national coverage in the media. Our current position is that to date we have received 8 families. We had an intention to accept 12 families by the end of October. There's been a hiatus. Our position hasn't changed, but there has been a hiatus, and that relates to the programme, the throughput of the programme involving the Home Office. And but the delay we don't anticipate to be significant or in any way likely to change our direction of travel. We think it's simply going to be November that we'll achieve our 12 families target. And our hope is to continue that and to reach our overall figure of 28 families by the end of the financial year. What that requires for us to do is to increase the availability and the infrastructure of staffing that we require to provide the level of support that would be needed, both to sustain support to the families that we are currently supporting, the new families that have recently arrived, and anticipation of the families that will be coming. One of the things that we've done, and it's been really effective, is we've refreshed our multidisciplinary working arrangements. There's been a new service manager in my own service that has been appointed to this, that's Anne Glendinning, and Anne has refreshed that multidisciplinary grouping, and it is now a really dynamic working very effectively group that involves our colleagues from housing, from education, from third sector, from health, and from within the HSCP and other partners, so that there is a really quite dynamic planned approach that we're able to take. A couple of the contingent factors that make this work effectively is if we're able to first of all secure what properties may be available and align that to available placements within schools, dependent on the number of children in any given family that might be arriving. If that works well, then it works very constructively. And we're then in a position to take families and to feed that through. We are keen to support the addition of a children's worker in recognition of the specific needs that children will have, taking account of obviously their experience that they've had, both in terms of the resettlement and any experiences that they might have had in the early parts of their life. And so thinking ahead in terms of the settlement and integration of the families as we welcome them here to Inverclyde. So the paper sets out our general direction of travel, our plans in terms of staffing, sets out the financial framework that allows us to fund that staffing, and it's wholly sustainable within the available resources. And I'm happy to take any questions.
Thank you, Sharon. Councillor Brooks has indicated, and then Councillor McCabe.
Thanks very much, Convener. Yeah, certainly welcome the report, and we certainly understand the challenges that the Afghani people have had, and obviously what's happened with the NATO military forces within Afghanistan. At 4.3 in the papers, there's an explanation about how the process works. And I understand, Sharon, you maybe can't see your papers. 4.3 is understanding about the mirroring up the available units or available houses to the families, and also that's a conversation, communication with the Home Office. My question is a two-point question. I'm assuming, and I don't like to assume anything, that the available houses are 100% from RSLs, local RSLs, because Inverclyde Council don't really have any houses. Well, technically they do. So is it all those houses come from the RSLs? And how are officers balancing the delicate challenge that some of our constituents have been waiting for years for family homes, and then RSLs are making available, I think, you correct me if I'm wrong, family homes for obviously this resettlement programme. So there's a difficult balance there, if my interpretation is correct. How are officers dealing with that challenge?
Sharon?
Yeah, again, sorry, apologies. I was in my report. In relation to the first part of the question, in terms of the availability, my understanding is that 100% of the properties do in fact come from the RSL. However, when you ask me a question and I don't have the absolute answer, and I'm not 100%, if I can maybe just undertake to confirm that that position is correct. But that is my understanding, but I'll just absolutely confirm that that's correct. I suppose I'm at some degree of difficulty in terms of answering the second part of your question, Councillor Brooks. I don't mean to be unhelpful here, but the straightforward answer is that it really is not an issue for the HSCP to balance the issue about the housing. Our task is to fulfil the direction of members, and you've given us a clear direction about what you want to happen in terms of the resettlement of refugees, and that is what we're aiming to do. Therefore, our task is to liaise with the RSLs in order to provide the accommodation to do exactly that. I understand the wider implications of the issue, and it might well be that it's really something for our RSLs to be able to provide some context about how they are managing to do that. I hope that answers your question as clearly as I can.
Thanks very much, Sharon. Thanks, Convener. Yeah, maybe it's then for members to obviously understand that we have instructed our officers to obviously bring in refugees and support in the context of the resettlement from Afghanistan, but be aware of the challenges that brings to constituents.
Councillor McCabe.
Yeah, thanks, Convener. I mean, this is obviously a humanitarian crisis, so we're right to respond to it. And the issues that I suppose Graham's highlighted there, and I might have highlighted myself at the begin first, are issues that are affecting council areas across the United Kingdom. Strains on housing, strains on schools, so we're dealing with the same pressures. The government are clearly wanting us to take Afghan refugees. Obviously, as I say, it's a humanitarian crisis, so we need to respond. But obviously, there are potentially longer-term benefits for the area if we take refugees and if we can ensure that they settle well here as well. And I think the additional resources that's been provided by the government this time certainly seem far more generous than they have been in the past. And I think provide us with the opportunity to do this well. Not to say that we were only doing it well before, but really do it well and try to build those sort of links with the families to try and help them settle better here in the area. So there's clearly opportunities for the community in making a success of this programme, as well as challenges around housing and schooling. And I think it would be useful maybe to get a sort of briefing at some point around the challenges that are being faced in terms of providing accommodation and schooling and the impact in other services as well. So just that, so that we're informed, because the reality for I think every one of us as a councillor is that housing is probably still the single biggest issue that we face on a day-to-day basis in our caseloads, and invariably it's about people not having the right size of housing, etc. in terms of that. So I think it's certainly something that we need to have an awareness of. I mean, just in terms of the overall situation, obviously when the report was written, it was talking about the government's planning to settle 5,000 vulnerable Afghans in the first year and £20,000 and 20,000 in the long term. The figure I saw recently was there's 14,000 in hotel accommodation across the United Kingdom. So there seems to have been certainly far more have come than was probably anticipating. Maybe that reflects on the chaos there was with the collapse of the government in Afghanistan. So, and it is important, obviously, we try and get people out of hotel accommodation as soon as we can and get children into school, etc. But it's a mammoth task across the United Kingdom, and it's not just Afghans that we're dealing with. There are obviously other refugee programs as well, and as we see on a daily basis, migrants try to cross the English Channel as well. So there is a huge issue here that is having to be wrestled with, and we clearly have to play our part in that. But equally, we need to understand the pressures potentially that it will place on local services.
Thanks, Councillor John Crowther.
Thank you, Convener. If I could just focus on 5.3, and that is the new posts. And bearing in mind that the Afghan families that will be coming to Inverclyde, many of them will be bilingual, i.e. they can speak both English and Pashto. And I was just wondering if it's possible if we could utilise these skills, bearing in mind that would probably cut out the requirement for the use of costly translation services. It also takes into account under 6.4, where it states that any unspent funds from the Afghan Citizens Resettlement Scheme would be returned. Would it be within our powers to try to train at least one member of the incoming Afghan families and employ them under 5.3?
Sharon, have you an answer for
Thank you. Yes, thanks, Convener. Thanks, Councillor. Yeah, one of the things that I think is particularly pleasing in the current arrangements that we have is that, and this might address a number of issues that have come up, is the multi-agency grouping that we've been able to establish, as indicated, is really dynamic. We really have been met with tremendous support from partners across the Inverclyde area. We've also been met with tremendous support from the Inverclyde community in terms of the willingness to help and support and to move this whole endeavour along. It's been overwhelming. It's been tremendous. Where we're at now, because this is in some senses potentially a maturing service. It's not a mature service because it's new relative to the other things that we do in the HSCP, but it's definitely maturing. So the practice is maturing at the same time, and we are really focusing now on a much more co-produced, self-directed form of intervention with families as they arrive. So in the very early stages of our resettlement programmes, we were fairly prescriptive. We're now really moving along a continuum of participatory involvement of the families who are coming and being informed by them about what they think the types of support are that are most effective to them. And that's, I mean, I have to tell you professionally, that's a really, really good place to be, and we're really pleased about that. That includes things like, what are the qualities and skills of the people that you need to support you? And do those qualities and skills exist within your own community? So you're absolutely right on the money in terms of where our thinking is, in terms of where we would like to, what we think the direction of travel would be. Achieving it will be difficult. Achieving it through proper process and so on needs to be balanced. So we need to do those two things in tandem. But our aspiration is exactly as you've indicated.
That's lovely. Thank you.
Jim McLeod.
Yes, thanks, Convener. I welcome the report. I'm glad that Inverclyde has welcomed these families to our district. We've been good in the past, welcoming refugee families to Inverclyde, and there's been a lot of positivity, and amongst the community as well, with families coming and settling here. And, we can't forget that these people are fleeing from persecution, or, they have either been persecuted or they could be facing persecution. So we can never forget that. We also have to think about the positive contribution that families in the past that have came here. Many of them come with trades and skills and qualifications which are put to good use. I remember when the Syrian families first came, they made us some food, and I've been to 3 or 4 different events now where I've tasted their food, and it's excellent. And I remember saying to a couple of officials, it would be great if they opened up, some of them opened up a cafe and sold their food. There's an opportunity there, there's a market there, and I'm glad to see that just a few weeks ago that's happened. There's a couple, I think it's 2 Syrian men who started a cafe in Greenock, and I think that's most welcome. So there are employment opportunities, and I'm glad John raised the point about interpreting. That's yet another opportunity. So yeah, welcome the report, and I hope that we continue to see some more families. I think that it's mentioned there's 28 families which are planned at the moment, and I look forward to us welcoming them. Thanks.
Right, we agree that the public part of the council is, Al Pearson.
Convener, thank you. Can I just note at 4.11, please, or just a slight change there. All the posts for the new team will be initial a 4-year fixed term contract. So can we just note that change, please?
Okay, we can get that noted.
Thank you, Convener.
That finishes the public part of the report.